All right, let's learn about the pelvis. Elvis the pelvis. This is actually a female, so it can't be Elvis. But it's a female. That's what the internet said. The females have slightly more open. Yeah, more open pelvis. No, it's not called a pelvi, but a more open pelvis for, the birth canal. But anyhow, let's do this. So, I didn't think you guys would want to see male's genitalia giant on the PowerPoint screen, so here you go.
The one I downloaded is a blue cloud.
I just changed this morning. Okay, so the anterior lateral view, these are some parts of the body you need to get familiar with, but not too familiar in the massage world, please. So you'll notice as you're palpating yourself and others, I'm going to hold this up here. The front hip bone here, this is part of your iliac crest. It kind of wraps around like this, okay? So, side of me, this is your whole iliac crest, all right? So you'll need to know how to find that and palpate it. Then on the front of the body, we have our ASIS, and on the back, we're going to go over what this is, our PSIS. That'll help you determine whether the pelvis is aligned or not, or if there's any dysfunction or asymmetry issues. So the happy trail area is called the pubic crest. Anything that says inguinal, we're referring to the groin area, so that's the front anterior portion of, the pubic area. So typically we're not working that area. Sometimes we might do some inguinal things on someone who really needs it, and I'll show you how to diaper drape so that we can appropriately and effectively work on attachment points close to the actual hip bone, okay? And then patella is knee, right? We're going to be talking about the quads. So one of the main quad muscles is your rectus femoris, and then we're going to talk about hammies, so the hamstrings, right? We're going to learn about all the quad muscles, or adductors that are in this, the inner leg area, and so on. Look at that booty. So, did you say he missed leg day? He didn't skip leg day. He skipped glute day. I think maybe he's lacking a lumbar curve. All right, so posterior lateral view. So I'm going to have you guys feel for the greater trochanter today on your humans that you work on. That is the top hip bone. This is your femur. Your greater trochanter is this big chunky section here that pops out. We need to know what this is because there's a lot of muscles that attach here to move your leg, all right? Oh, that thing pinched me. So greater trochanter, we have the gluteus medius, maximus, and minimus. There's not just one. There's 3 gluteuses. And I'll kind of show you guys how to find those. I don't think today, I think part 2, we're going to go over glutes. So that's next week. Depending on what we go over, we'll determine what I show you guys today, I guess. And then your IT band, straight down the side. It's also the iliotibial tract. So let's do this. Here's the back end, the rear end. So from this picture, your erector group, right along your spines, you have that. And here, this picture here, this has the PSIS. That is what I'm talking about. So in this picture here, I'm going to zoom. All right, so it's right off of the gluteal fold to the side. And you'll kind of feel that, and then it becomes the sacrum. See how this becomes sacrum? Oh, yeah, cleft, sorry, the fold.
We are going near.
No, not the fold. See, I got it wrong, too. The cleft, the crack. Okay, so from the back end here, see how this like actually shows like a round, like a butt, right? That top heart part, I call it, is where the iliac crest is, right? He probably has really weak glutes because he's clenching. That's like what I do. Oh yeah, here's a cleft. A gluteal fold is that bottom portion where your hamstrings are going to attach onto the pelvis, right? Hamstrings are the back, upper legs. And then behind your knee, remember we call that the popliteal fossa, popliteal region. Good stuff. Let's learn some main bones of the thigh and pelvis. First and foremost, we're going to talk about the femur. So the femur is the humerus of your leg. It is the biggest bone in your body. And then we have our pelvis. All right. So the sacrum, you guys should know what a sacrum is by now. The coccyx, the tailbone, right? And then we're going to divide the actual pelvis into 3 main bones, even though they're fused. So we have our ilium, which is on the top. That's why it's called the iliac crest. The pubis in the front, think pubic area. And then the bottom, this is your sits bone. This is the bone you're sitting on, is your ischium. So they call this down here the ischial tuberosity. So you have a lot of things attached onto the ischial tuberosity. Good times. I love the pelvis. No comments. Here's the lateral view on how we would scientifically divide up the pubic bone. I mean, humans do. Yeah. So the ilium is the largest, right? Ischium is in the back, pubis is in the front. Makes sense? So if you can just like, and right here, this is where the greater trochanter goes. You know, that's your hip joint. So if you just divide it kind of almost in half and say anything half above is ilium and the rest are below. Peanut gallery, silencio. These people here.
Those were special cookies.
Special carrots. So here's your anterior overview. We're going to look at, here's your umbilicus, so your, belly button. Here's your lumbar vertebrae going into the sacrum, right? So this section in the pubis area is called the pubic crest, all right? The joint. This section that comes along here is your superior ramus of the pubis. So there's different, names. Pubic tubercles in the front, right? And then we have our AIIS, ASIS, and those are these little notches here, right? And then iliac fossa, iliac crest. Woo! A lot of stuff. A lot of stuff. But remember, fossa is usually just like a concave area that a muscle sits in. And then here is a detailed version of posterior. And we're going to go over all of that. For funsies, here's we'll just say your sacrum, right? Here's your greater trochanter. So here's that top of the femur. Then you have something called a gluteal tuberosity that, perhaps maybe your glutes attached to. What? There's a line on the, we don't have our man anymore. Here's part of it. The pectineal line here is another attachment point for muscles. And then we have more lines that are called linea asperas. All right, so your medial and your lateral. Remember how we have condyles of the humerus? Well, there's condyles of the femur. So that's where your knee joint would be. So these bad boys sit there. Your adductors would be in through here. The big section of your bones, the shaft, right? All right, here's the one you will need to know, that ischial tuberosity that I had talked about, that bottom here. You'll need to, this is the spot that feels really good when you push on it and apply pressure. Like it just takes, it kind of stretches those hammies a little bit and just, oh, it feels so nice. There's a giant hole called something called the obturator foramen. Remember, foramen means hole. There's teeny tiny little deep, very deep rotator muscles called the obturator and so on. Internus, externus, there's two, right, that are going to be deep through here. You're not really going to be palpating the obturator, internus, or externus, really. You'd have to really do a lot of pressure. All right, trochanteric fossa, whatever, all these extra things, right? Those are the ones that are important that I think for our muscles. Okay, so our ISs. You can learn the word, you should learn the word. So ASIS is always anterior, superior, iliac spine. This one is anterior, inferior, iliac spine. So that's saying it's on the iliac spine. It's anterior. One is superior and one is inferior. The main ones we're going to be looking at is ASIS and PSIS for trying to figure out alignment issues. So moving on here. Side view. You guys kind of get the point, right? So I'll let you kind of study those, and you'll be writing them all up in your workbook and getting familiar with some of those main body bony landmarks, that I feel are important. More of them. Here's some more of them. But you guys can kind of go through and try to match it in your free time. Sure, that sounds fun. So, and then here is the lateral hip. So again, pause the video, try to match it. Or if you guys are just looking at the slides, try to see if you can match it. You probably have the same picture in your workbook anyhow. Same here. So the red will be bony landmarks, the black will be actual bones that are part of the pelvic region. All right, the femur. The head of the femur is the ball that goes into the socket. Let's start here. The main things I need you to be familiar with is the head, the greater trochanter, and then on the other side we have this little guy that's the lesser trochanter. So kind of think of it as the tubercles in the shoulder, how you have the greater and the lesser, right? The greater's bigger. Your shafty poo. And then you have your condyles, and remember above it is your epicondyles. So this surface in here is where your patella sits. It's not just sitting. Your knee is full of tons of ligaments that keeps this joint together. And those ligaments can be injured, and that's when you have your MCL, ACL tears and stuff like that. So the back view. Yeah, double check. Again, your condyles, epicondyles. Then here you would have your supracondyle lines, right? Linea aspera is in the back, right? So cool, man. Let's talk about some trails. The solo pass. I really dislike this section of the book. I think it's lame. But the solo pass, we're going to kind of trace along the iliac crest from the bless you, from the ASIS. Here's the whole iliac crest, and we're going to end at the PSIS. A, B, C, D. D, pubic crest, right? E, ischial tuberosity, sits bone is what they call, and then F, greater trochanter.
Access your own pelvic region first.
Yeah,
That's what it says.
touch your own pelvis.
We're allowed to do that in class.
Man. The iliac adventure, this is like the same exact thing. So this goes ASIS, pops you down to the inferior, pops you back up to the crest.
And that's because trail 1 is for yourself. That's why it's called solo. Trail 2 is that you can do that on your partner.
Ah, solo pass. Makes sense. Listen, I haven't read this book in years. PSIS. Now, you're not really going to be feeling much of the iliac fossa, other than when I show you how to do a hip flexor release. Those suck. Those, it hurts so bad.
I will
That
accept
sounds
it.
great.
I will accept it.
I'd love to have my hip flexors.
So the tailbone trail,
No, he always said,
careful when you're palpating this on your partner today, the tailbone. And don't go straight down to the coccyx or you're going to be straight down really close to the beehole. Okay, so no rectal massages, please. That's not appropriate. So you can kind of feel, you have a little bit of movement at your SI joint, very minimal. So you can kind of feel like a little bit of a spring as we're kind of assessing the hips on people. And when there's an alignment issue, for instance, maybe we'll say right side is elevated. See what happens to the spine, all right? So when that happens, I don't have any muscles on him right now. So say I'm going to pull him up. Now what's happening is all these muscles are going to be trying to straighten this up. And what happens is this starts to rotate to kind of balance this, to kind of bring it back down, all right? So thank you, sir.
hypertonic. I don't know, but Carrie's asking me.
What's going on?
I said, which muscle is hypertonic?
For that situation?
Hypertonicity. Of what
Carrie's
muscle?
studying for the MLab. She's smart.
I would say your QL.
Yes.
So a little movement here.
Like says yes.
The MBLEX said yes.
I don't know.
Oh. So when you're feeling around somebody's sacrum today, try to find the spot where, usually around here is where you have like the back dimples. You know how some people have back dimples, right? But try to feel, and there's so much connective tissue right here that it's hard to feel anyhow, but you can kind of try to differentiate between, there's a little notch here, which is your PSIS, and then where you can sink in to the sulcus, they call this, all right? Sacral sulcus. So in through here, you have all your multifidi and your erector muscles for your spine coming in here, and a lot of, remember that thoracolumbar fascia coming in through here. So a lot of this is not, you're not going to be feeling a lot of muscle tissue here. You're going to be feeling a lot of connective tissue here, right? And remember, connective tissue can have dysfunction too. And that's why it's really hard to treat sacroiliac dysfunctions. So it takes a lot of work from the client and a lot of work on you and PT and whatnot. I like the pelvis. This guy's cool. I don't even have like my camera view, so I can't even show it. I'm a shameful person. Okay, the underpass. So this is going from belly button, front view. We're kind of doing one of these. Belly button to pubic crest. We're not palpating this on anybody today. Maybe your partner's at home. No, I wouldn't. And then along that front area, that's that ramus, and then it bumps down to the ischial tuberosity. Loudness. This is the one I forgot to censor. Sorry, guys. So if you were to palpate the inferior ramus, which you're not, it would be right on the inner groin area, okay? Hip hike. So this is how I'm going to have you guys feel for the greater trochanter on the side of the hip. You'll kind of notice here, it's typically on thinner people, but it could be anybody where there's like a dip in the actual body here. This dip here, right under that, is where that greater trochanter is going to be. So there's going to be, because there's not really anything here but muscle, right? So there is going to be a dip because there's not a bony area right there. Oh, God, I didn't mean to. Whatever, let's move on. Stick 'em up, larger than life. I don't know what that means. So, end of that. Not the end of today. We're still learning. So I'm going to talk about the upper leg a little bit today and some muscles involved. So the front of the leg is going to be where your hip flexors are. Remember, everything from the knee up flexes forward. The knee flexes backwards, so it's the opposite, right? So your hip flexors are all going to be in the front of your hip, and then when things start changing, your quads are actually going to be the ones that are straightening your knee. So your knee is the exception. So quadriceps, front, hamstrings, back. Here is a picture of the pelvic floor. We are not going to be addressing the pelvic floor. Yeah, that's weird. We're not allowed to do internal massage unless it's intraoral, okay? So a physical therapist or maybe a chiropractor might be able to do some type of work.
I actually got to see that.
You got to see it?
Mm-hmm.
Somebody doing an internal release?
Mm-hmm. Married to me. Yeah.
Stop it! Get out of here!
No,
We are recording!
seriously. Actually,
Oh, really?
Oh, yeah.
Well, there is a pelvic floor specialist in Zanesville for anybody in that area. There's one in Cambridge?
A friend of mine is a PT instructor or professor, and they teach that.
Yeah. It's cool, like, because it can really help somebody that maybe, their pelvic floor is very weak. A lot of times it's, guys have pelvic floors too, by the way. But it's usually associated more with women and after childbirth. All right, so strengthening these pelvic floor muscles could help with incontinence issues. It can and posture overall, strength. Maybe you're having the SI joint keeps going out because the pelvic floor muscles are really weak. So you need the inside to be nice and, toned enough to keep all the bones where they're supposed to be. I just keep slamming the pelvis. So here's a weird view of the pelvic floor. But yeah, moving on, we don't care. Okay, so the hip. Let's talk about the hip and the actions. So your hip can flex and extend. When I'm talking about hip flexion, remember, we're talking about what your femur is doing, not what your knee and below is doing. So, when you flex your hip, your leg is getting closer to the center. When you extend your hip, your leg is straightening or going behind you, right? So you have tons of hip flexor muscles involved and adductor muscles that would be involved with these actions, okay? So a lot of things are happening. Extension. So the extensors, okay. This is the fun part. Your hamstrings flex the knee, but help to extend the hip. So it has dual purposes, all right? But not all of them. Yes, just kidding, all of them. All right, so those are extension. Now let's talk about rotation. So your hip can rotate medially, yeah, and laterally or externally. So here are your medial rotators. Your glutes are involved here. You have adductors involved here. And then you also have some parts of your quads involved here. So That's the hard part about legs is there's multiple actions happening within these muscles. Here's your lateral rotation. So think of it this way. Your medial rotators are tending to be medially. Your lateral rotators are going to be more on the outside typically. Makes sense? Because it's trying to pull your leg this way, so they have to be over here. If it's on the inside, it's going to be pulling this way into internal or medial rotation. Alrighty, so your lateral rotators, glutes do this. You have some abductors that do this, and adductors. So that's confusing, right? You're like, I hate this class. It's so good. Hip abduction. So you adduct and you abduct, right? Your hip abductors are mainly going to be in your butt, right? So if you want to strengthen these, you do squats with an abduction. Yeah, that guy missed that part of this. And then you also have some, this is actually called your sartorius, but that'll assist with that hip abduction as well. That's a confusing muscle, mainly because it crosses the whole leg, and you're like, what direction might this be pulling?
I guess all from the top.
Yep, so this is stationary, and it's attaching here and pulling it to give it that abduct. Adduction, bringing it away. In. Just kidding. We're adding it back to the body. I don't know what I'm talking about. So that's going to be mainly your inner thigh muscles. All right. And then, part of the adductor group as well. Gracilis. Good stuff. Can't wait. Let's talk about knee, what the knee does. Now, technically, it doesn't just flex and extend, right? And I'll show you how. So it either flexes, bend your knee, which is primarily your hamstrings, right? Or it'll extend, which is primarily your quadriceps. Now, if your knee is in a fixed flex position, you can do slight rotation. So this is how a doctor would test your knee to see what the rotation, how far or how lacking you have to determine whether you have certain ligament tears in your knee. So if your knee is straight, you cannot medially or laterally rotate anatomically. Okay, you have to be in this fixed position. All right. Let's talk about the quads and the hammies. So the quads, the word quad means four. There are 4 quadricep muscles. It's not just one giant chunk. So we have the first one in the middle. So these kind of give you an idea based on the name where they're at on the front of the thigh. The first one in the middle, the big guy, is the rectus femoris. If you see that word and you see the word femur, we're talking about a giant muscle that's on the femur. So that is the only odd man out. The rest of the quadricep muscles are vastus something. So we have vastus medialis. That is medial. We have vastus lateralis. That is lateral. And then if you were to strip all these muscles away and go underneath rectus femoris, you have vastus intermedius. So he's in the center. Cool? Yes. Let's talk about what these bad boys do. So, as a whole, we're just talking about all the quads as a whole. They extend your knee. They also flex the hip. The reason why there's two actions at different joints is because they cross both the knee and the hip joint. That's why there is some kind of action happening at both. So, the origin. We'll talk about the rectus, the first guy. He originates on your AIIS. So, your anterior, inferior, iliac spine. So this is why it has a movement with a flexion. You have a muscle here, and he doesn't have his whole leg, so I'm just going to start it here. If this shortens, this is what's happening to the leg, okay? So if I'm activating this muscle fully, I'm flexing and at the knee and flexing at the hip, right? Extending, just kidding. We're like this. I can't do that. I'm not strong enough or loose enough. I said it wrong. So you are flexing at the hip, extending at the knee. So if you were to be like this, straight leg, sitting on the ground, bending forward, you'll feel the hamstrings stretch, right?
Your toes so you don't pull your nerve.
It hurts. What'd you say about your toes?
Point your toes when you're seated forward fold and you reach for your toes. If you point your toes, it prevents you from stretching your sciatic nerve. If you flex your toes back towards your knees and you reach for your toes, it feels more intense.
It does feel more intense.
You're pulling your sciatic nerve.
Oh.
You're welcome.
And you're stretching the lower leg muscles, so your gastroc and soleus. You're stretching all that, and your Achilles tendon straight down into the foot. So yeah, you would feel that deeper. All right, rectus femoris starts up here at the AIIS, right? And then it runs down. There is oh man, I don't have him. There's a little notch under your knee that is called, are you ready for it? The tibial tuberosity. It's on the tibia. So this is where all of those connect. It crosses the knee joint, right? Since I don't have my big skeleton. Quads, crosses the knee joint, and all of them come together and find that little notch on the front below your knee, and that is your tibial tuberosity. And that is why it also straightens your knee. So if I have this muscle here pulling this leg towards me, it's giving you a kick position or action. Kicking is good. Let's talk about the vastus medialis. Where's the picture here? So remember those lines I talked about? Yeah. So this guy starts at the medial lip of the linea aspera, runs down, and then connects again to past the knee to the tibial tuberosity. Vastus lateralis. So they're kind of like in line. Do you see this? Sort of. Woo! Vastus lateralis. Lateral lip. So medialis, medial lip, lateralis, lateral lip of linea aspera. It also starts at the gluteal tuberosity and the greater trochanter. All right, so it's lateral, so now it's kind of going on the top of that hip bone, right? Running all the way down past the knee, again on the tibial tuberosity notch on the front. Last but not least, vastus intermedius originates on the anterior and lateral shaft of the femur. Just know that it's on the femur, okay? All these are going to be on the femur, running down past the knee. And where is it ending up? Tibial tuberosity. Good.
At least somebody was listening.
Thank you. All right, hammies. Again, we have one odd man out. Ham, just think of, there's 3 letters in ham. There's 3 muscles in hamstrings. So ham, your hammy bone. We have your bicep femoris. Your leg is opposite from your arm. We have a bicep brachii. Well, this is, if I were to turn this around and this is your foot, this is your bicep femoris, right? Femur, it's on the femur. So if you have a quiz question asking you where the bicep femoris and the rectus femoris is, just think of the leg being opposite of the arm and that it's always on the back, and by process of elimination, rectus is in the front, okay? So, odd man out here, bicep femoris. I have trick questions on there. So, do not click biceps brachii. Don't be shameful. So we had our quad muscles that were kind of the same. Now we have the semitendinosus and the semimembranosus. The difference between the two is tendinosus kind of ends into a tendon, right? I mean, they all do, but it's more tendinous. And the membranosus is more membranous. I don't know if that's a word, but I made it up. So this is a view of those. I'm going to zoom here. Here's the tendinosus, right? And the membranosus. And we're going to go, I think the next slide shows them one at a time. So you can kind of see that. All right, let's talk about that main squeeze, the bicep femoris. So it flexes the knee, right? It's in the back. All these hamstrings are going to flex your knee, right? And then when your knee is flexed, this muscle at the tendon could actually laterally rotate your leg. See how the tendon comes to the lateral side, right, of the leg? So that's how, when it crosses that knee joint, might kind of pull that a little bit, right? There's multiple heads. The long head would extend the hip a little bit and assist laterally with the hip, all right? Lateral rotation, sorry. There's so many words that my brain just goes sometimes. If this muscle is super tight, it's going to tilt the pelvis posteriorly. So when people are having low back problems, that's why I try to educate the clients and say, please let me work on your hamstrings. Because if those are tight and it's pulling that pelvis into a posterior tilt, you're going to have a lot of problems. All right? A lot of problems. So your long head and your short head. The origin of the long head attaches on your sits bone, basically your ischial tuberosity. Your short head will start at the lateral lip of the linea aspera. And then it runs down, and since it's on the outside, it actually connects on the fibula. So that tiny bone, not the big tibia, okay? It's actually longer, I think. All right, semitendinosus. Look at this bad boy. So this guy's kind of more, on the medial portion of the back of the leg, right? Flexes the knee. Since it's medial, it'll medially rotate the knee if flexed. It'll help extend the hip. Yes, thank you so much. You could just put it on that table. Appreciate it, thanks. It'll assist in medial rotation, again, since it's on that side, and it'll also tilt the pelvis posteriorly. So these hamstrings tilting. Originates ischial tuberosity. That's why it's important to drape, and we can actually work along that ischial tuberosity if the client's comfortable with it, and do some pressure, some trigger point work on those attachment points. It hurts, but it feels so good. A lot of times I just do my whole forearm. My ulna kind of goes straight in that region, and it feels good. Right, it runs down and it inserts onto the proximal, so upper medial shaft of the tibia. And there's a tendon that it turns into called the pes anaserinus. So that's why it's called semitendinosus. Say that 10 times fast. Semimembranosus. Ooh. So I'm going to let you see the difference between the two real quick. We're going to go back to tendinosis. See how it's mostly muscle? See how this has a lot of membranous or connective tissue? Okay, so that's the why. That is why it's called semimembranosis. All right, flexes the knee. Medially rotates when knees flex. Extends the hip. Did you guys get the gist of this? Knee flexor, hip extender. Assists with medial rotation. Tilts the pelvis posteriorly. All right, starts at the ischial tuberosity, runs down and connects on the medial condyle of the tibia. Okay, we got through hams and we got through quads. That's all the muscles I'm going to throw in your direction today. Next week, we're going to hit all the glutes and the adductor groups and have fun with it. Whee! Oops, I hit the wrong button.